that you feel is relevant to this particular panel? We're going to start on the far left.
Mic check, mic check. Hello, everybody. My name is Dr. Bernard Ashby. I'm a vascular cardiologist based in Miami, Florida, and I am part of RMRN gang. And with RMRN, I'll let them explain that to you later. But
no, go ahead.
Oh, yeah.
Yes, please. Yes.
Okay. Well, it's an organization of black male physicians that love our patients.
I love that.
Very much, and love our community and serve our community in every possible way. And we formed organically during the COVID-19 pandemic. I guess you could call it organic. Earl the Third, EC3 basically brought us together like the Avengers, and we've just worked together collectively. I've worked with Gerald on multiple things like keeping a student in medical school and not getting them dismissed. I've dealt with Mozzie, Dr.
Wait, give the full names.
Yeah.
You can give them credit. Give their full names and what they do.
Keep it short. We gotta get out of here by 2:15.
We're gonna be good.
I'll just wrap it up. But essentially, we just build together. And in terms of me, I am a independent vascular cardiologist. I have my own practice down in Miami. In addition to that, I'm a medical director at Larkin University and professor of medicine at the University of Miami.
Hello? Yes. My name is Dr. Drake Dudley. I am a dentist in Nashville, Tennessee. We have the first 24-hour emergency services in general dentistry. Things that I'm involved in Nashville, I work with several different organizations that are underserved, such as like Next Door, which is a rehab program, Dismas House 413, which is a transitional program for individuals getting out of prison. And what I try to do is ensure that we're providing services for those individuals that are trying to take the next step in life because, you know, they've been down and out in a lot of situations. And mental health is a big issue in America. And we know that teeth are very important as far as representation of how you feel about yourself. And I think being on the ground and providing those individuals with, you know, just self-awareness and self-care, I think that's very important. Not only, you know, coming from an underserved environment, I know how important it is to actually have access to dental care. We plan on scaling as much as possible into some of those underserved areas because I know how important it is to have access. And so that's what I'm doing on the ground level. I've worked with Gerald for several years. We started programs like Project Dream, where we reached out to high school students and tried to encourage them to go into dental school, medical school. We've been doing that for quite a while, and so being a representation is so important, and I'm just happy to be here.
Wonderful, thank you. Dr. Brown?
Good afternoon, everybody. My name is Dr. Isalo Brown from Sacramento, California. I am a clinical assistant professor, soon to be associate professor at Stanford in emergency medicine. I also serve as the social justice and health equity curriculum thread leader. What that means is I make sure that medical students get access to the knowledge around health disparities, around social structural determinants of health, so that they come into the workplace understanding these unique barriers and the things that drive health inequity. I would also say that I wear a second hat as a community health advocate, an organizer, grassroots organizer. There's a group called TRAP Medicine that I'm the Chief Health Impact Officer for, as well as that TRAP Medicine stands for Trust Research, Access and Prevention. We work with barbershops and leverage that space and the human capital within barbershops to increase the health and wellness of black men and boys. I'm a part of RMRN. This is something that I don't think has ever happened before, where a group of like-minded individuals who are all physicians recognized the central problem during the COVID-19 pandemic and were able to provide health advocacy and awareness digitally in a way that, again, has spread very, very rapidly. So using these different channels, we were able to increase the education and awareness of health disparities. Something I'm passionate about, something that I've worked with Gerald on since my time here at Meharry. Drake, I've been a speaker at Project Dream before, so they've been doing fantastic work for years. I'm going to pass this over, but thank you all for having me today.
Yeah, I'm gonna
I'm gonna go next just because he's gonna be a very tough act to follow.
Very smart. So everyone up here is very intelligent. Please.
So I'm in a different part of my journey. My name is Dr. Marius Chikora. I'm actually a non-invasive, board-certified non-invasive general cardiologist. In 2 weeks, I'll be credentialed as a sports cardiologist training at Mass General Brigham at Harvard. So my journey is a little bit more nascent relative to theirs, not to age these gentlemen. I probably have a little less gray hairs on my face. But I'm coming out of my second fellowship, going to start working at MedStar as a sports cardiologist. The work I've done is actually probably a little bit more premature in the career journey. At Howard University College of Medicine, where I graduated in 2018, I served on the admissions council to help try to diversify the classes as much as possible as you can at HBCU, but more so to give people who didn't really have a chance by the numbers, statistics, the board scores, I should say the MCAT, the entry exam, try to give them a fair chance, just because we understand, all of us understand that, being a good physician is more than just a test score, right? So that was a lot of the work I did early on. Went on to serve as regional director of Region 6 in the SNMA. So that's an organization meant to promote cultural competency, raise social awareness, and clinically excellent physicians that are minorities as well. Really delegated and oversaw all DMV medical schools and the chapters at those respective schools and make sure those initiatives were pushed forward. And then also in residency, I trained at Duke University Medical Center. Go Duke, go Blue. For internal medicine, and while I was there, I served as the president of the Minority House Staff Association. So there, again, just doing a lot of things to help not only recruit minority talent, but retain it and provide implementation of initiatives to, diversify the workforce. Because as I'm sure we'll get into a conversation, best patient care is served when you have diverse minds taking care of patients. So thank you for the opportunity. And I'm also part of RMRN as well.
Can you guys explain what RMRN stands for? Are we allowed to know?
Real medicine right now. That's
okay.
We try to keep
yes,
the organically real approach to medicine, evidence based of course, but we want to make sure we meet patients where they're at in the moment that they're at too.
Amen.
And are all the members of this organization Black male physicians?
They are. Yeah, they are. Yes.
Wonderful.
So thank you for having me. Thank you, Gerald, for the panel. So I'm Dr. Kevin Simon, originally from Brooklyn, New York. Currently, I serve as the inaugural Chief Behavioral Health Officer for the City of Boston, and that's a position I was appointed by Mayor Michelle Wu back in 2022. Clinically, I'm a child psychiatrist, board-certified child psychiatrist, adult psychiatrist, and addiction medicine physician, operating out of Boston Children's Hospital, and assistant professor of psychiatry at Harvard Medical School. In terms of what this panel is about, and thinking about pathways, and I use the word pathways because for some indigenous communities, pipeline is actually a term that's sometimes not preferred. We have had a $21 million investment into student behavioral health. So looking at I'll just reference three things. A pathway where we're going to have 300 Boston residents who get trained into behavioral health careers, and that could be licensed mental health counselors, school psychologists, and having a pathway going back into the Boston public schools. We've done the first mental health report for the city of Boston, and then we actively have a public mental health campaign, all with an emphasis on those have structural challenges as it pertains to the social determinants of mental health. So access to education, transportation, food, employment. So those are some of the things that we're doing within the city of Boston, and that's a little bit about myself.
Amazing. Would you like to finish off?
They know me.
Okay. I just want to applaud everyone real quick for all the work that you guys are doing. Like, I would like to acknowledge how challenging it is for all of us to be doing things individually. So I like that you guys have kind of formed a quorum together to try to not have us each be doing individual things. And I just want to also recognize that we are all completely different specialties for the most part. We have vascular surgery, we have dentistry, we have emergency medicine, we have child psych addiction medicine, we have sports cardiology, internal medicine, and dermatology. So I'm going to speak about myself for a little bit, but I do want to have us, again, go down the line and talk about why it's so important for in each individual one of our specialties specifically to have better representation and cultural competency for our patients specifically. So again, I'm Dr. Meena Singh, board-certified dermatologist and dermatologic surgeon. And so I'm most well known for being an expert in hair loss. And it's really, really important because when I was in residency, what happened? I've told him so many times what he can do. He refuses to do it. So he has someone that he's very close to that can easily, this is what I do all day. Anyhow. So the reason why this is so important is because there's an actually epidemic of hair loss in Black women in particular. When I was in residency in the mid-2010s, actually, there was a study that came out that showed that Black women in particular sought out dermatologic care for different reasons than other demographics, completely different reasons. So for our fair skinned patients of European descent, it was, skin cancer, eczema, things like that. For Black women, it was acne, discoloration, and then hair loss, which is completely different than other demographics. So I figured I probably should learn how to figure that out and actually address it, because we have another dermatologist in the audience, Dr. Awasika. If you are a Black female dermatologist, Black female patients will seek you out specifically for the things that they, are concerned about. And so even if you have no interest in hair loss as a dermatologist, if you're a Black female dermatologist, you will be seeing a majority of patients with hair loss. So anyhow, I did a fellowship in procedural dermatology, and it was funded by the International Society for Hair Restoration Surgery. So I became an expert in hair transplant, specifically in Afro-textured hair. And so the reason why that's so important is because just like everything else that we're talking about, our stuff is just so different. And in dermatology, it's really, really important because we're talking about sports cardiology, all these things. If you break a bone, for example, and you happen to be a patient of African descent, generally it's the same rules, same guidelines for fixing that. With dermatology, it's completely different. Our presentations are completely different. The ways that we treat it, the ways we address it are completely different. And if you're not comfortable with addressing that, meaning you didn't have the training in patients with skin of color, you can actually disfigure your patients. So it's completely different. And same thing with hair loss. If you're not comfortable, you can miss the diagnosis. And if you're a hair transplant surgeon and you miss the diagnosis, you have really bad outcomes, bad scarring, and you're doing your patients a disservice. Anyhow, so basically I learned how to do hair transplant and Afro-textured hair, which has completely different considerations. And to bring this long story short, what I'm doing for my community is I have a Afro-textured hair workshop where we train other dermatologists on how to do hair transplant in curly textured hair. We have basically a hair loss finder for patients. It's called docsforhair.com. It's where patients can go to find doctors that specifically know how to treat our hair and know how to treat hair loss. And then the particular workshop that we did a couple of months ago, we collaborated with another organization called Strand that partners with hairstylists, teaching them what they can do as the front line, because they're going to be the first people to kind of recognize that we have hair loss, and how to partner with dermatologists to better address it and care for our patients and our local demographics. So that's been some of the initiatives that we've been doing that really are taking off right now and been really helpful. So after this, I would love to talk about your barbershop initiative, because like I said, all this stuff sometimes we do on our own. Locally, I practice in Kansas City. I do a lot of stuff with the local barbers where I'm doing workshops in their in their shops, and it's nicer to do it in a more national setting. So, anyhow,
Mina, can I jump
yes.
in? So, my wife, her name is Dr. Brittany Halford. She's an internist and she's a hospitalist, so she sees people that get admitted to the hospital. And last year, there's an African American female. She was kind of boarding, or she was waiting for being transferred. And one of the things in terms of being able to recognize a variety of symptoms as they present differently. This woman, she just seemed very despondent, and Brittany recognized her hair was kind of like matted, and she just was curious. She asked the nursing staff, has anyone washed her hair? And they're like, why would we wash her hair? They said, well, she seems like she would need it. And so Brittany, on her own accord, went to local Walgreens or CVS, purchased shampoo, and with the staff, ended up washing and cutting the woman's hair. A couple days later, the woman's aspect changed. And Brittany brought that up to me. I was like, I think you probably should tell your chief about this. And interesting enough, so she works at Beth Israel Deaconess Medical Center. And following that, we then go down this rabbit hole of, well, what services and what resources actually do we all get when we get to the hospital, if you're admitted? And mostly it's this small shampoo, fine toothbrush or comb, and it's like, oh, they don't actually have products for a diversity of people. And so through, she's had multiple patients like this. Through that, we then brought that to the administration for BI. And they did shift and actually make an initiative about hair care for all.
Okay, so thank you for bringing this up, and this is why we need to all kind of do initiatives together, because the local Children's Mercy asked me to do the same thing, to offer a more diverse, because they have children of all demographics, and you can't give the thin lotion, and we end up still being ashy, and you can't give the same hair products, and then our hair is not going to be amenable to
And I
controlling
know
that.
this is not a hair panel.
No, but this we're talking about cultural competency
I do want to
and representation.
I want to ask my colleagues here, because I just learned this last week. Did you know there's dry hair shampoo?
You
I
know what?
The folks who have locks know.
I did not know. I did not know. Again, these are things that we're not necessarily taught in medical school. But if you have experiences